Do you really need anatomy and physiology and microbiology to become a nurse? So this video is addressing a question that a lot of people seem to have, and it's mostly when they're in their prerequisites. How valuable is anatomy and physiology and microbiology going to be when you actually become a nurse? Well, the short answer is it's valuable. If you're asking me if you're going to need it, hell yes. Yes, you will need it. So to kind of break this down, when you think about anatomy, that part, you want to know where things are located. Obviously, that's important to a nurse that's working in acute care. You got to know your directional anatomy, your medial, where's your medial line, where's your lateral line. When a doctor is writing notes that tell you where something is located, you need to know what that means. So it's also important to know where these structures are located. If you are using a stethoscope and you need to auscultate the lungs or listen to the lungs, are you going to put the stethoscope on the forehead? No, obviously not. And then there's physiology. Physiology is basically what tells you why things do what they do or what it's for. And knowing your anatomical landmarks, it is crucial for a lot of the nursing functions, like placing IVs, providing wound care, or accurately describing where things are to a doctor. Like if there's a new wound on the patient or some kind of concerning lesion. So if anatomy is the roadmap of where everything is, physiology is basically the GPS navigation. It's how those parts all work together and why. So you need to understand that the heart pumps blood. You also need to understand where it goes. You need to understand that the kidneys filter waste. We need to understand that nerves transmit signals to each other. Physiology will provide you with all of that information. Now, this knowledge is vital for interpreting vital signs. It's vital for interpreting lab values. You need to know the critical signs of things. What will this high fever be doing to the brain and to the body? Understanding these processes allows you to anticipate some potential problems that could be coming along. You can identify abnormal findings when you know your physiology, and you can provide the appropriate care or interventions in conjunction with what you know about physiology. Now, when it comes to microbiology, it is the study of microorganisms, basically. So your bacteria, your viruses, your fungi, you're going to learn all about that in microbiology. These are the things that can make our patients very sick. These are the things that can infect a wound. These are the things that we can ingest. So as nurses, we are constantly dealing with infections. Again, these are the things that can invade your body and wreak havoc. So getting that understanding of microbiology helps to grasp how infections are spread, so we can better stop them and know the precautions that we need to take. So in the hospital, there's going to be some precautions. Some patients might be on isolation precautions because there is a particular type of bacteria that patient has, or that there's a concern for. So if they have chickenpox, you're going to be put on airborne precautions to let you know the proper types of attire you need to be wearing before you enter that room. So you have to know your enemy when it comes to microbiology. What is that particular bacteria resistant to? What destroys that bacteria? Things of that nature. So your knowledge empowers you to also educate the patients on infection precautions and what it is that they have. You can advocate for proper hygiene. You can better advocate for proper hygiene when you know your enemy, and you also understand the why behind many of the infection control policies that exist in your hospital. So imagine that you have a patient with heart failure. Your knowledge of cardiac anatomy tells you which chambers what chambers and valves would be involved in this condition. And then your understanding of physiology explains why their heart isn't pumping effectively and how it will impact the other systems in the body. And you also understand that all of the organs are interconnected. So if one fails, it's going to put more pressure or more work for the next organ in line. You'll discover that. So if the heart isn't pumping effectively, it's obviously impacting other organs or systems in the body, like the lungs and the kidneys. And if it develops and if you develop an infection, your microbiology knowledge guides your care to prevent the further spread of the infection and to help you manage the infection effectively. So these aren't just isolated subjects, they all work together to help with your nursing knowledge. They integrate to form a holistic understanding of your patient's health and illness. Could you effectively perform some of the nursing duties without this knowledge? Yeah, you might, but could you provide truly safe, effective, and independent nursing care not knowing these subjects? That's highly unlikely. All of this mixed together, your critical thinking skills, your ability to problem solve, your confidence as a nurse, they all stem from a solid foundation of having these 3 courses, these 3 types of sciences. And some of you may need to take chemistry in addition to this. So it all works together. You must have an understanding of the pH balance. So chemistry is ideal. So for all of you future nurses wondering if your time is being wasted, or you don't understand why you have to take Anatomy and Physiology 1 and Anatomy and Physiology 2, just understand you need to be embracing these subjects. If not embracing it, at least getting a C so you can move on into the nursing program. Yeah, so you can move on into the nursing program. I understand that these subjects are challenging. Believe me, I was in anatomy, I was in physiology, I was in microbiology pregnant, but still, you learn what you have to learn and you move on. Now, are you going to be able to recall all of this information is another issue. Do they expect you to recall everything? No, at the very basics, you should know where the organs are located. You should know what they do. You should know the chambers of the heart. You should know if there's any other chambers for anything else. You should know the structure of that thing and how it works at the very least. So there are some cells you will need, they will talk to you about sometimes in anatomy. There's some cells they will talk to you about in anatomy and physiology. Do you have to know about the specific macrophages in order to do your job as a nurse? No, you don't have to. But these subjects are challenging, but they are very essential and very crucial to becoming a good nurse. And for current nurses, when you do become a nurse, it is effective to your nursing care to refamiliarize yourself any chance that you get, so that you can keep that knowledge solid in your mind. What are your thoughts about this? I'd love to know, so just drop it down below and let me know. Please like, share, comment, do all the things. Help the YouTube algorithm, and I'll see you in the next video. Hopefully you found this video helpful. I'll see you in the next video.